An estimated 1.6 million new cases of cancer will be diagnosed this year.
Currently, there are more than 14 million people living with cancer in the United States.
By the year 2022, that number is expected to grow to 18 million.
80% of cancer patients are treated in a community setting.
There are more than 1,200 federally qualified health centers in the United States.
There are over 21 million patients served by federally qualified health centers.
One of the hardest things in the U.S. is that the cost of care often impacts whether someone can get care. And the federally qualified health centers play a critical role in connecting patients to primary and specialty care, regardless of their ability to pay for that care.
Our studies have consistently shown that people who are at high risk for financial burden, who are, depleting their savings and their retirement funds, and also at high risk for depression or in distress, they're the ones who are at risk for the poorest outcomes. That means that they're the ones who are most likely to show poor adherence because they're having to make very difficult trade-offs and they don't have the resources to do it. That's why we need to be going to where people are, where they're experiencing most financial burden, and you'll find them at federally qualified health clinics.
So we are so excited to have cancer support services here at Whitman Walker, and I think many people ask why would we want those additional services to link to primary care, and I can't underscore how critical it is. When somebody gets a cancer diagnosis, sometimes they're getting the initial results from their primary care doctor. Maybe they found a lump or they found some other issue, and then we're sending them out in the community, but we are their medical home. They care about coming back here for their care, and we want to ensure that all the services they need to stay connected to us as their primary medical care provider and their cancer care out in the community are very seamless, and that they feel really strongly about that. So we couldn't be more happy to have added that incredibly important array of services.
If a patient is being treated at a federally qualified health center, we want them to have access to the clinical trial information that we have. The Frankly Speaking About Cancer clinical trials series is so important. Our photo narrative is written in the patient's voice. It shows other patients that look like them, that sound like them, and all of the employees, all of the staff at the federally qualified health center will have access to this information. They'll be trained on how to share this information, and we truly believe that when that information gets into the hands of the patients, they will be more likely to choose a clinical trial that's right for them, and instead of not choosing that. And those barriers are so important, especially in this patient population where there is so much fear, where there is a history in some cases of distrust of the medical establishment. We want to help to overcome that, and we feel that getting into the federally qualified health centers is a huge step in overcoming that barrier.
Cancer support community has a whole suite of services that we believe could really benefit and improve the quality of lives of the clients of federally qualified health centers. And we believe it's really important that we expand our mission, we expand our work, and we go into these centers across the country and we develop partnerships like the very successful one we have at Whitman Walker Clinic.
Help us to make a difference in the lives of these individuals.
Help us make a difference in the lives of these patients.
Help us to make a difference in this community.
Here at the Cancer Support Community, our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by their community. Please help us help the federally qualified healthcare center community. Thank you.